So for this next portion, I'm going to assess your motor system. So I'm going to do a series of tests to assess for your balance and coordination. So I'm going to have you do, the first test is called the Romberg test. And how the Romberg test works is you're going to shut your eyes, hold your hands at your sides, and I'm just going to be here in case you start to move. And he's got a slight drift, but that is normal. So that's good. Now you can open your eyes. Now, so then the next thing I'm going to have you do is put your hands face out and close your eyes. Okay, you can open your eyes. So he has a slight drift there as well, but how it would be positive is if he started to do this and just kind of pronate on his way down. So then I'm going to have you stand on one foot. Good. And then stand on the other foot. Good. And then I'm going to have you heel to toe walk across here. Good. And he has good balance there. And so then the next thing I'll have him do the finger to nose test. So I'm going to hold my finger up and you're going to touch your nose and touch my finger, okay? Touch your nose, and then touch my finger with the same finger. Good. Keep doing it. Good. Good. Okay, and then the last test for the motor function is to take your heel, touch it to your knee, and slide it down. Good. And we would do all of this bilaterally as well. For the first part of this video, I will be assessing my patient's musculoskeletal system. So I'm going to start by assessing his face and neck, and I'm going to palpate for any tenderness. And just clench your jaw for me. Do you have any tenderness as I palpate down here?
No.
Good. And now I'll just palpate down his neck. Any tenderness?
No.
Good. So now I'm just going to test his range of motion. So I'll just have you turn your head from side to side. Good. And then touch this ear down to your shoulder. Good. And then the opposite ear. Good. And then put your chin to your chest. And then extend your head back. Very good. So then I'm just going to have you stand up and turn to the side. And I'm going to inspect your back. Your shoulders look nice and symmetrical. And I'm just going to palpate for any nodules or tenderness along your spine. Any tenderness as I move down your spine?
No.
Good. Okay, so you're going to just lean forward to me and touch your toes. And I'm just checking to see if his spinal column is straight, which it does appear to be straight to me. So have you stand back up. And then I will have you sit back down here. And I'm just going to start with his upper extremities in the sitting position. So I'm just palpating. I palpate bilaterally for any kind of edema, any kind of extremity discomfort. Do you have any discomfort when I bend your extremities?
No.
Okay, good. So then I'll also look at his digits. He has 5 digits on both sides, normal. And then I will have you do some range of motion. So I'll just have you touch your thumb to each finger. Good. And then I'll have you do the OK sign on this side. Perfect. And then I'll have you spread your fingers apart and then spread your fingers in. And then I'll have you turn your hands over, which is pronation or supination, and then turn your hands back, which is pronation. And then just take your hands and move them out, eversion, and then hands in, inversion, or abduction and adduction. And then I'm just going to palpate his wrists for a range of motion. Good. And then this one. Good. And then the next 2 things that I'll do is I'm going to test for the Fallon's and the Tunnel sign, which are signs of carpal tunnel. So I'll have you hold your hands together like this. And then I'd have him do this for about 60 seconds. And if he feels any numbness or tingling down his fingers here, that's a sign of carpal tunnel. So after 60 seconds, I ask him, do you have any numbness or tingling?
No.
Good. Okay, and so then the next thing I'll do is have him just turn his wrist over, and I'll just tap here on the nerve. Any numbness or tingling when I do that?
No.
No. So those are all negative signs of carpal tunnel. So then I'll just have him stand up, and I will assess his range of motion in his upper and lower extremities. So just put one arm out, good, and then back in, and then I'm just going to move it in a circular motion. Good. Perfect. Okay, so now your legs. So what I'll have you do is move one leg out, so eversion, and then the leg back in. Good. And this leg back in so we can see. Good. Okay. And then I'm going to have you bring your leg out. Good. And then back in. Very good. And then bring your knee to your chest. Good. Perfect. And you can sit back down. And I'm just going to check his muscle strength as well. So I'm going to have you hold this arm out. And then I'm just going to have you push against me. Good. And then I'll have you push against me this way. Good. And then I'll have you push against me. You might not be able to see his feet here. I'll have you push against my foot. Good. And then push against my foot this way. Good. So the next part of this assessment is the nervous system. So I'm going to start by going through and assessing all of his cranial nerves. So cranial nerve number 1 assesses for smell. So I have something here that I'm going to have him smell. So just include one of your nares on one side, like this, and just breathe through it. And you can breathe through that way? Perfect. Perfect. And just close your eyes, and I'm going to have you smell this, and you tell me what it smells like.
It smells like mint.
Yes, it's a mint. So his cranial nerve 1 is intact. And so then the next thing I'll do is I'm going to check his visual acuity. So I do that using a Snellen chart so to test his visual acuity far away. And then I would use some fine print like newspaper print to test his visual acuity up close. So can you just tell me what this says right here?
Sky is blue.
Yep, perfect. And then the next, so that's cranial nerve number 2. And that's intact as well. So then I'm going to test number 3, 4, and 6 all together. And the way that I'm going to do this is I'm going to check his 6 fields of gaze, and then I'm going to check his PERLA, so are his pupils equal, round, reactive to light and accommodation. So I'm going to have him, I'm going to start and I'm going to do an H with my hand. So just follow with your eyes. Okay, good. And then I'm going to check his pupils with my flashlight here. So just look straight ahead at my finger, okay? Good. So his pupils are equal, round, reactive to light, and they're about 4 millimeters. So that shows that his cranial 3, 4, and 6 nerves are intact. And then I'm going to check his face for sensation. So I'm going to use a sharp pin over here to just check some slight sensation. Do you feel touch over here?
Yep.
Good. So we do that very lightly, but just to check for sensation in his face. So cranial nerve 5 is intact. The next one we'll move on to is cranial nerve 7. So we're just going to assess for face symmetry. So I'm going to have you raise your eyebrows and then give me a smile. Perfect. So, and then I'm going to have you puff your cheeks. Good. And then show me your teeth. Good. And then kind of put your lips into like a pursed and blow out. Good. So the cranial nerve 7 is intact. I can see his face is symmetrical through all those movements. And the next nerve I'll assess is cranial nerve 8. So I don't have the tools to do a Reiner rubber test, so I'm going to do the whisper test. So I will whisper something in his ear and he will repeat it to me.
Dog, cat.
So I'm going to test on his opposite ear.
Mom, dad.
Good. So his cranial nerve number 8 is intact, his acoustic nerve. So then I'm going to move on to cranial nerve 9 and 10. So I'm going to check for a gag and movement of his soft palate. So I don't have a tongue depressor, but that's how I could check for his gag reflex. But I'm going to look back into his mouth. So stick your tongue out. Perfect. So to assess for that gag reflex, we can use a tongue depressor. So cranial nerve 9 and 10 are intact. Cranial nerve 11 is to test the shoulder and neck muscles for strength and movement. So I'm going to have you push up against me. Good. And then push against this side. Good. And push against this side. Good. And then finally, cranial nerve number 12. I'm going to inspect his tongue for movement, symmetry, strength, and absence of tumors. So stick your tongue out. His tongue is midline. Move it to this side. Move it to this side. Up. Good. It looks good. I don't see any nodules or tumors, symmetrical, and moves appropriately. So for this next portion, I'm going to assess your motor system. So I'm going to do a series of tests to assess for your balance and coordination. So I'm going to have you do, the first test is called the Romberg test. And how the Romberg test works is you're going to shut your eyes, hold your hands at your sides, and I'm just going to be here in case you start to move. And he's got a slight drift, but that is normal. So that's good. Now you can open your eyes. Now, so then the next thing I'm going to have you do is put your hands face out and close your eyes. Okay, you can open your eyes. So he has a slight drift there as well, but how it would be positive is if he started to do this and just kind of pronate on his way down. So then I'm going to have you stand on one foot. Good. And then stand on the other foot. Good. And then I'm going to have you heel to toe walk across here. Good. And he has good balance there. And so then the next thing I'll have him do the finger to nose test. So I'm going to hold my finger up and you're going to touch your nose and touch my finger, okay? Touch your nose, and then touch my finger with the same finger. Good. Keep doing it. Good. Good. Okay, and then the last test for the motor function is to take your heel, touch it to your knee, and slide it down. Good. And we would do all of this bilaterally as well. This portion of the nervous system exam, I'm going to test his sensory system. So I'm going to test his sensory system in his extremities for superficial tactile sensation. So I have a small pin here, and I'm just going to touch it to his arm. Can you feel that?
Yes.
Good. You feel that?
Yes.
Good. So he has superficial tactile sensation is present. And then I'm going to just do it a little slightly harder.
Yes.
That's his superficial pain sensation, so that's present as well. And then I'm going to go and do the 2-point discrimination test. So I have 2 needles, 2 pins here, and it's a paper clip. I just bent it apart. And I'm going to poke him with 2 points, but I'm going to move them slightly closer together and then farther apart and see if he can tell if it's 1 or 2 points. So just tell me if it's 1 or 2 points when I poke you with this, okay? And I'm going to do it on his fingertips because that's one of the most sensitive spots.
1 point.
Okay.
2 points.
Good. So this paper clip is about 3 to 4 millimeters apart, so he has good 2-point discrimination. He is very sensitive in his fingertips, which is good. And do you feel any numbness or tingling in your arms?
No.
So no graphesthesias are present. And the next part of the neurological system that I'll assess is his deep tendon reflexes. So I'm going to start by assessing his biceps reflex. I don't have a tool to check his reflexes, so I'll try to use my fingertips. It might not be as great as if I did, but I'll at least show you where the position of the different reflexes are. So a biceps reflex is right underneath here. So I would hold his arm just nice and relaxed, and I would try to stimulate his biceps reflex. And then I would move on to his triceps reflex, which is right here, which if he did, it would be a nice tight reflex. His brachioradialis reflex is right over here. And then I'll move on to his patellar reflex. So ideally we'd have him kind of hanging in a relaxed position. He's tall, so his legs touch the ground, but we'd have his legs nice and relaxed, and I'd feel for the notch here. Good. So you can see that his patellar reflex is intact. That one's a little bit easier to do with just your fingers. And then I will do his Achilles, which is in the back on the Achilles tendon. And then the ankle reflex, which is over here. And then the last thing that I'll look for is if there's any kind of clonus. So I'll just flex his leg forward, and then when I slowly come back, I don't see any kind of clonus. And clonus kind of looks like just a movement, like a twitching movement like this, and there's no clonus present, which is normal. And the last part that I will do is the Babinski test. So in an adult like him, the normal reaction is to have his toes curl in. An abnormal reaction would have the toes fan out. So I'm just going to have you put your fan up. And what I'll do is I'll go like this, and a normal reaction would be to have his toes go like this. They didn't fan out, which is a good sign.